detailed video on how much I spent for my BBL and liposuction journey as a category 1 client, as at the time I did my procedure. Hi guys, my name is Evie, and if it's your first time of coming to my page, thank you. And please, if you're intending subscriber, subscribe to my page, comment, like. Let's get into it. So I'm 6 months post after my BBL and liposuction procedure, and as at the time I did my procedure, this is how much I spent. I'm going to be explaining when you want to do your BBL or liposuction. The billing is basically on 3 types, meaning it depends on your weight. They bill you based on your weight, which means you're going to belong to the category that your weight fall into. So as at the time I did my procedure 6 months ago, I was in category 1. Category 1 start counting from 65 to 77, and as at the time I did my procedure, my weight was 77. So after 77, then category 2, we now proceed to 87, then category 3. But I'm going to be talking about category 1. So if you're watching this video and you fall under category 1, then this video is going to help you to be able to know how much you're supposed to save up for your procedure, if you plan to go for a BBL or if you plan to go for a liposuction procedure in Nigeria, because I did my procedure in Nigeria. So first off, I did an online consultation which cost me about 40,000 naira. I did an online consultation and it cost me about 40,000 naira. Then I did test. The testing was 75,000. Then I did test 3 times, because as at the time I did my test, my doctor was like they needed my blood level to be a lot higher than it was before my procedure. So I had to do my test 3 times to be sure. And also they told me to buy supplements to be taken for the blood level to go up and for other things. And the supplement, I bought it twice, which cost me about 200,000, because it's 100k and I bought it twice. Then after that, my lipo 360 procedure, which is fat removal from your tummy and your back, which is the liposuction 360, for me was 2.5 million naira, because I'm in category 1. If you're in category 2, your price is going to be a little bit higher. So but this is for category 1, and my 360 lipo cost me 2.5 million naira as at the time that I did it. And then I did my hand lipo, which cost me about 1 million naira. And also I did armpit, breast and chest, which is about 500k each for armpit, breast and chest. And but I got discount, so I didn't really pay the full 1 million naira for the armpit, breast and chest. And also I did a transfer to my hip. So normally a lot of people do their procedure and they do like a BBL and all that, which is the Brazilian butt lift. But for me, I didn't do a BBL, like I didn't do a full transfer to my butt. I just did like a hip dip, which is where a lot of people that I see most of the time, they do like the full BBL. So if you guys want to know why I decided to do only my hip dips and how I actually know that you can do only your hip without doing a full BBL, just leave it in the comment section and I will make a video about that to explain to you guys. So I will proceed. Then after that, after the transfer, when the artillery, like they give me, for my daughter actually gave me my hand for her, and then he also gave me a faja, and then lipo foam and the anesthesia and everything. That cost me about 1.6 million naira. That's about 1.6 million naira for all the whole artillery and everything. So after that, central line. So if you don't know what central line is, basically they made an incision on my neck so that they can be able to give me drips, give me injection from there, because since I was doing my hand, my hands were swollen after the procedure. So for me, I don't like needles, so I didn't want them to be poking me all over, looking for how to actually be able to find my vein and everything. So that was the reason why the doctor said that I should pay for them to create a central line for me. And it's really better if you pay before the anesthesia and they do it when you are asleep. Like when you're asleep, and that's when they create the central line, is better, because if they tend to create the central line when we are wide awake, you're going to feel a lot of pain. So if you want to opt for central line, please make the payment before your procedure, so that they actually do it when you are asleep under the anesthesia. You're not going to feel the discomfort, because even when you're awake and the central line is on your neck, the discomfort is actually more. So talk more of if they decide to do it while you're awake. So that aside, then I paid extra 50,000 naira for ulcer. So if you're an ulcer patient, you are asked to pay for extra money, because so that for ulcer drugs, because in my clinic, everything they don't subtitle everything I give you, and also my clinic, they don't charge you in dollars. So that's the reason why I'm actually calling them in naira. So I pay 50K for ulcer drug, because you wouldn't want to be feeling ulcer pain with all the pains that you're going to be feeling after your procedure, right? So I paid that 50K. Then admission for 3 days, because I was actually admitted in my clinic for 3 days, and plus the admission fee is different from the nurses that are going to be attending to you 24/7. Like the moment you ring your bell, you actually have a nurse at your beck and call. The nurses are going to be attending to you 24/7, and everything, the drugs. They said I had like a fever, or they used extra drugs for me during my healing process for that 3 days that I was admitted. I ordered food, and my discharge fee, everything amounted to 600K. That was what I used to discharge. So since I left the clinic way like early, I left like 3 days. So if you are a stranger, like you're coming to Nigeria to do it, and then you're staying in a hotel or wherever it is you're staying, your first 10 days of massage is compulsory if you're doing your surgery in my clinic. So the nurses were coming to my house for 3 days, and I was paying for their transportation for like every day, which cost me 30K for 7 days. So this is basically what I spent for the procedure, like for the first day of my procedure to day 10. So aftercare is not inside this, but I'm still going to make video. Stay tuned, subscribe, like, share, and comment to so I'll make the next video for how I actually manage my aftercare. I'll see you guys in my next video, guys. Bye.